Good morning to everybody. Hope everyone is doing very well. Now, I'll be discussing on the National Autism Strategy. Also, just one question. Do you want me to present the presentation so I can make a screen share? This is our National Autism Strategy. I'll be reading the entire presentation. So if anyone has some questions, they will also go to the Discord channel. So here we go. What is the strategy? A good question. A national strategy detailing all the measures and the initiatives that the government will be undertaking in the coming years with respect to increasing awareness on how individuals on the autism spectrum go about their lives. This strategy is the first of its kind in Malta and has been worked up since 2018. It was launched jointly by the Ministry for Inclusion and Social Wellbeing, together with the Autism Advisory Council, mainly us, which UM alumnus Dr. Alistair De Gaetano currently chairs. And also he will be joining very shortly. Now, for the introduction, expertise from the disability, education and health sectors was guaranteed through representatives of the relevant government ministries and their corresponding faculties within the University of Malta. While most of this work was done in Malta, we also made sure to factor in more international perspectives, participating in events and discussions abroad, including at European Union and United Nations level. To listen to other views, we present our experience and engage in a mutually beneficial debate. We will work through the National Coordination Mechanism within the Directorate for Disability Issues, DDI, set up in terms of Article 33.1 of the United Nations Conventions of the Rights for Persons with Disabilities to ensure a streamlined implementation process for the content of this document. Now, let's get into the category of autism. A lot of people have asked us a lot of questions regarding the condition. We've taken all of your questions and we have responded with these. We will work together with you and with other partners locally and abroad to produce awareness campaigns showing what autism really is and really is not, and to challenge existing stigma and feelings to shame by family members and persons on the autism spectrum alike, while debunking discredited theories about autism, its origins, and the autism interventions. We will use different methods to spread our message across, such as in-person visits, social media, campaigns, regular print, and audio-visual media. We will ensure that persons on the autism spectrum, their families, and significant others are at the heart of developing and delivering these campaigns. On the early indication and autism interventions, we will ensuring regular monitoring and review of methods used to keep them in line with the best international standards and to make sure that delivery of services such as counseling and psychological support are not treated as purely medical interventions, but instead are delivered in a humane and socially holistic manner in line with the social model of disability. We will developing further existing genetic services, both in terms of capacity building and health service development and training, focus on identifying and underlying etiology and neurodevelopment disability, while ensuring that data gleaned from such services in use towards appropriate ends. Now, in the education department, we will work together with you and with relevant government bodies and education providers to work out when children are still as young as possible, and that the state is empowered to take necessary steps in the best interests on the child as part of this process, in order that children will be able to access the most appropriate services and supports as early as possible and without delay. Now, we will also make further efforts to ensure the inclusion of certain students on the autism spectrum into mainstream education to ensure they receive their academic entitlement rather than resorting to methods such as extensive use of withdrawal rooms. We will also review the programs offered by schools and make recommendations concerning updates to existing programs and new programs. Now, in the employment, we will work together with relevant government entities to ensure new firms, particularly foreign firms, with a track record in the autism field and local startups to operate in an autism-friendly manner. Also offer guidance, financial incentives, and the people on the ground on these firms, including job coaches and job mentors. Also explore a system for certifying and acknowledging autism-friendly employers. Also encourage the use of social enterprises on the field of autism, both for the benefit of persons on the autism spectrum and especially with the involvement and even the direction of persons on the autism spectrum. Now, on the advocacy, self-advocacy, and outreach, we will cooperate with non-governmental organizations and in particular organizations of students and young people, including the National Youth Council or KNZ, to ensure that advocacy and self-advocacy are not merely actions limited to activists or self-advocates in the autism field, but are streamlined into the daily activities of those organizations, which would be structured on the principle of universal design. Empower all the members through ensuring that the organization practices inclusion in all its process and activities. Encourage participation by the empower and actual potential members on the autism spectrum, including by supporting and encouraging them to hold positions of responsibility within said organizations, such as becoming board members, having fostered by autism-friendly environment. Also, prepare persons on the autism spectrum for the effective participation in political and public life. Now, in the autism and adulthood, we will focus particular efforts on targeting decision makers and providers, including through updating relevant laws and policies where necessary and through providing continuing up-to-date training. We will contribute working in particular with adults on the autism spectrum and their supporters to the discussion on reforming the law. We will start the discussion working with you and with all the relevant stakeholders in Malta and abroad on the topic of autism and aging, to eventually also explore specific needs and challenges in this area and start working towards addressing them. Now, we get to the last one, the Autism Advisory Council. We will continue working with you, as we always do, throughout the process of implementing this plan through the National Coordination Mechanism within the Directorate for Disability Issues, or DDI, throughout the process of monitoring the implementation of this plan and reviewing it at regular intervals through the Council and its structures, to create terms of reference for reviewing and monitoring the progress achieved through the implementation of this plan, including through the use of social impact assessment process and analytical indicators. That is my presentation. I thank all of you for listening. I will also be answering your questions on the Discord channel.
Okay, thank you, Blaine. Can there be questions now?
Yes, of course. Also will be joining in, so both of us will be answering them.
All right, so Alistair, oh yeah, welcome.
Hi, thanks, Blaine. Thanks, everyone.
Yeah, so if someone has a question, just raise your hand, your digital hand you have in the on the reaction button. All right, I see already one, Miria, so yes, please.
Hi, I just want to ask in what way with more information you're going to implement, or you are implementing methods within schools education for inclusive education concerning autistic children. I mean, what kind of seminars will be interested in sharing information with you?
Okay, so I can actually clarify about that. So with Malta, there was already a national inclusion policy in place from the past few years, which basically did not just like deal with disability, but also with other areas, such as basically, I mean, students who are gender fluid, for example, or students from ethnic minority backgrounds. When it comes to disability, a lot of the focus is on autism, because a lot of the requests that actually happen are, for example, for supports in classrooms, and many things which are related to autistic needs. What is happening is this: in the Autism Advisory Council, which is the body which is set up by law in Malta, which worked on the strategy, and which will also like work on both its implementation and its monitoring through different chambers. There is a representative of the Ministry for Education there, so the National School Support Service, and there is also on the monitoring side a representative of the Faculty for Education of the University of Malta. So what will happen is this: it is a 10-year system. We will actually like see what is already being implemented under national inclusion policy, what is actually like coming out of the strategy, and there has to be an implementation plan agreed with different stakeholders to actually deal with the different gaps that there are. Like what is being done right now in practice is that when it actually comes to any issues which have to do with autism, the National School Support Service, Ministry for Education, deals with these. And if there's anything which actually requires other ministries, for example, if there's any support that requires speech and language therapists, then it goes to the Autism Council. So you can actually have interministerial coordination. However, we do realize that there are a number of issues and a number of gaps. So the strategy will basically be the roadmap to be able to have a forum in which to identify where things are still lacking and be able to work on them like together. There's always the civil society input there. The council does have representation of autism NGOs and also autistic persons. It's also in the law. And also the council has a like autistic persons working group in it. So I mean, there's always like direct input, like from the ground up. And this way we can actually like work better in this respect. Awareness is also a very important thing, and outreach. Maybe Blaine can also like speak a bit about that, because especially pre-COVID, we had a number of seminars where we actually gave training to heads of school. There was also cooperation with the National Autistic Society in the UK through a local foundation. So we actually organized seminars for them where different autistic persons spoke about their experiences in school also. Right now, these things are shifted online for practical reasons, but it's one of the things that we also like want to deal with from an inclusion point of view. I don't know, Blaine, if maybe you want to give some more overview about the trainings we had actually done, like with the X Foundation.
Yeah, sure. On the X Foundation, basically the training is to how to better take care of children on the autism spectrum. Some have difficulty managing their behavior. So the teachers are provided with these new training programs to basically handle most children with autism, mostly around the smallest age, from let's say to 5 to 10. Since at that age, it's always very difficult to manage them. But with the right training, most teachers and also the support teachers will also be taking good care of them, make sure they're properly monitored, and the children will also be learning the up-to-date the education system, which all of them will be learning the new subjects, the new implementations of basically how the education system will be implemented, and also be better taken care of.
Oh, actually, I'm working on a sector that I know that will be a sensitive matter, that many autistic people are affected or more vulnerable to drugs and addictions. Do you have any strategy about this subject? It's new actually, and we are dealing with it with an organization here in Cyprus, but it's a new subject and the parents won't accept that maybe some of their children that will not be assessed correctly in school or from a doctor might end up with addictions.
So in this respect, there's nothing specifically in the strategy, National Autism Strategy, about this. National Autism Strategy was meant to be a very simple document, basically a framework, a roadmap. So I mean, then there can be a proper implementation plan. That being said, however, this could be one of the things factored in. What the strategy does mention is outreach, especially on the youth front. The National Youth Council is mentioned, and also one of the activists within the working group, the Autistic Persons Working Group, is actually an advocacy officer at the National Youth Council, so that does help. The National Disability Strategy does mention the need to actually cooperate with the National Youth Agency in Malta. So there's like a body which deals with youth affairs, aside from the National Youth Council, to also like outreach out to vulnerable disabled youths. So I mean, so also like include vulnerable autistic youths. So in any case, like I mean, going forward, once the implementation plan for the like strategy is like fleshed out better by council, this is definitely something that can be taken on board. There is a basis for it. It's just like not mentioned specifically in the strategy at this point.
Okay, thank you. Thank you very much, both. Thank you very much. Thank you.
Thank you. I just see, just take a look. Yeah, there's a question in the chat from Lucy. Will good quality
Yeah.
special yeah, you read it already?
Yeah, yes.
Okay.
So, I mean, this was one of the big fights we had, basically, which was just still ongoing. It's not just in Malta, other countries also. Because I'm aware, for example, that in Ireland, it's also like one of the big like things, because I was also in contact with activists there. So the thing is this. I mean, it is also the law in Malta, basically the UN Convention, like has been transposed fully. So has been made part of our law, the UN Disability Convention. And the Disability Convention mentions that you have to mainstream children. However, we are also aware that like with children in general, be they autistic, be they disabled, be they whatever, sometimes there would be particular needs which have to be focused on. So first of all, there is the role of support teachers, we call them LSCs, the learning support educators. So they are available like for kids who need them. There's a system for that. They can be one-on-one or they can be shared. However, like we are like working both in terms of the National Disability Strategy and of the National Autism Strategy to end the system of special schools. There will still be certain children, let's say a very, very small percentage, those who have, let's say, complex, let's say, support needs. For example, those who are, let's say, on the medical like devices and like need constant care. So this usually can be like go even beyond autism. I'm not talking about autism, I'm talking about in general. So with those children, you would actually need like some kind of specialized support. However, like the whole point of mainstreaming is that we don't just want to plop children into classrooms. There's like two like sides working on the Malta. First of all, because of universal design, making sure that, I mean, the classrooms and also like lessons are designed in a certain way to include as many like children as possible, but also to make sure that there's peer sensitization so that the other children can also be part of things. However, there's the whole thing of resource classrooms instead of like resource units. Because before, okay, if you were autistic, you either went to a specialist school in certain cases, or else you went 2 or 3 days a week to a specialized center, which was basically became dumping ground. So instead, there's the concept of actually having classrooms within the mainstream schools. So if, for example, with mathematics or with Maltese, you actually like need a very, very different approach to your learning, then for certain subjects, you'd actually like do them also like with other like children who actually have similar needs, be they autistic, dyslexic, whatever, within, let's say, these classrooms in the mainstream school. But as far as possible, you'll be integrated into other lessons. So I mean, the social element is not lost, and children do not like feel left out. This is not the same as the withdrawal rooms, which they mentioned in the presentation, because there has been a bit of a mania in past years. Okay, so something is difficult, send them their support teacher to the resource room, let them cool down a bit, maybe there's some sensory toys, but it's not about that. It's about making sure that with education itself, you get the education that you actually need, but you are still mainstream. So, I mean, there's like people who like it, people who don't like it. You can't keep everyone happy. It's obviously a very fine line because every case is different, but this is kind of, let's say, the best balance we're actually trying to find in terms of autistic students and disabled students in general.